All right, we'll go ahead and get started here. Folks still might be trickling in, but that's totally fine. It is 9 o'clock, so we'll go ahead and get going. So we're happy to have you join us for Beyond the Bus, It Takes a Village, our annual symposium here. A little bit about HERDA for folks who might not know. We were formed in 1981 to serve Region 11, so Boone, Dallas, Jasper, Madison, Marion, Story, and Warren County. We provide door-to-door service, and we have a lot of exciting things, like a volunteer program that you'll hear about, and some other projects as well. And there are our social media handles as well as our website if you'd like to check it out. Your support staff today, you'll see Emily Koss. She is from Capture Management. She'll be providing our kind of like a day of support. So if you have any technical issues, go ahead and find her in the message or the chat function. Otherwise, myself, Julia, and Brooke Ramsey will also be on the call. And there are that's our email addresses for those. Some housekeeping. All sessions will be recorded, be available on our YouTube and our website at a later date. Closed captioning is available to toggle on and off for those who would like that on. Please keep your camera off and audio muted unless you're speaking, just so we can kind of make sure everybody has enough bandwidth and everything to get going. There will be time for some Q&As, so go ahead and put your questions in the chat or raise your hand when that time comes. Like I said, if you need technical assistance, let myself or Emily Koss know in the chat. And then you can also move the videos if that's kind of obstructing your view. You can go ahead and drag the. So our agenda here, we have CTAA Scott Bogren to give our keynote, Transportation State of the Union. They'll talk all things transportation and kind of how that is looking right now. Then we'll be joined by Taylor Clock, who will be talking about how to be an advocate for transit. We'll take about a 10-minute break. Then we'll go to the value of volunteerism by Michelle Raymer from Volunteer Iowa. We'll take a 30-minute lunch break. Then we'll go ahead and give an update from HERDA's side about some of the projects we're working on. And then we'll do an hour-long panel with HERDA's volunteer program, or a volunteer coordinator, as well as two other folks. Sam is not joining us, but we have someone else who will be sitting on that. And then finally closing. And then that is our emails once again, and I will turn it over to Scott. Scott, thanks for being here, and go ahead.
Thanks, Danny, and it's appreciate the invitation. Worked with Julia for, I don't know, it seems like a long time, Julia. I don't know. I remember she came here to DC at one point to do a congressional hearing on behalf of smaller transit systems all around the country, and I've always been impressed with the work HERDA does, and appreciate the opportunity to kind of talk a little bit about more broadly about kind of a, I don't know, a state of the union of public transit, which seems to always be in some sort of flux. But let me load up. I have a presentation that will hopefully keep me on track. Can everybody see that?
Yep, you're good to go.
Awesome, thank you. So this I prepared this for we do a lot of state meetings, and in fact I presented this yesterday outside of Charlotte, North Carolina, to several hundred transit operators in North Carolina. So it's pretty current, and it kind of captures, I think, our thinking here at CTAA about where things are. And for those of you, a brief, we have about 1,200 members. We're a national membership association. I think we might be closer to 1,300 right now. We really work with rural communities, smaller cities, tribal communities, specialized operators, which means people serving older adults, people with disabilities, veterans, kind of targeted populations, and then folks that are doing non-emergency medical transportation. And a lot of our members are doing pieces of all of that. So don't look at those as kind of like very exclusive, but rather kind of in a little bit broader way. And in addition to participating in sessions like this, we train a lot of drivers. We tend to train 300 to 400 drivers a day in passenger safety and sensitivity skills that they need to have. We also have certification programs for every level of a transit system, from management to drivers and maintenance and mechanics, and a lot of the positions in between, dispatchers, safety officers, and frontline supervisors. We do a lot of technical assistance. We run the National Center on Mobility Management. We also run the National Center on Accessibility, Transportation Accessibility, and we have so many acronyms and so many, the National Center on Applied Transit Technology. We're advocates. You'll hear from Taylor, who does a lot of that on behalf of the association, following up. And we do a lot of resources that folks like Julia and Brooke need to run systems like HERDA. We're about to launch our updated salary and benefits survey. So we've surveyed hundreds of systems around the country, and this can give management at an agency like HERDA an idea about, where do our pay scales compare to other rural systems? What kind of benefits are we offering? That's just one example of the kind of resources we provide. I'm going to start off with some talk about funding and investment, because like anything else, like any other business, it's kind of a backbone. It's what pays for the drivers, the fuel, ideally, and in good times, the new vehicles, and all the technology that's necessary to allow HERDA to do its job. And it's been a roller coaster, really, of investment in federal funding over the last 3 and 4 years. Like everything else, the impact of the pandemic was significant, continues to be significant. And I think we all felt like we were dealing with unprecedented issues at this time 3 years ago. And I think we also all thought that 3 years from that point, some of this would have been settled. And though I think we're in a better place as human beings today, I think, we feel a little safer. The world is reopening, and there are still impacts from that we're feeling. Give you a sense, just in broad terms, there were 3 different federal pieces of legislation during the first year and a half of the pandemic that sought to ensure that public transit continued. And they were broad, and they were, as those of us were here in Washington, D.C., the response was largely to throw money at the problem. And so what we ended up with was, at first, in late March of 2020, the CARES Act passed. And that was followed by what we call CRISTA, which was a second tranche of funds, and which was finally followed up by the American Rescue Plan. Like I said, all those went through in about 18 months, and all told, for transit, it invested about $70 billion with a B, off budget, at 100% federal. And it was fundamental in allowing a lot of transit systems to survive the pandemic. And these were investment levels. I've been working here in DC as CTA's. I've been the executive director here since 2016, but I've been working for CTAA since 1988, so basically forever. And I never thought I would see funding levels like this, $70 billion. And for Iowa, what that did was it took the typical amount of money that would land every year at the Iowa DOT, which the Iowa DOT, as the recipient, would then flow out to all of the rural operators across the state of Iowa. It basically dropped all at once 3 times that amount of money that they would get. And it was intended largely for operations, so paying for staff, fuel. It was not intended to buy things, buses, technology, bus shelters, anything like that. And the bigger cities received the bulk of the funds. So large urbanized areas, over 1 million population, received about somewhere between 85 and 90% of that $70 billion. Rural communities, Herta being one, received about 5% of that total, just to give you some context. And the bigger cities really mowed through that money very quickly. Here we are 3 years later. Most of those funds have been obligated, which means they have a home. They've been budgeted and are in the process, if they haven't already, of being spent. And when I say that, I mean, I think the last figures I looked was like 99% of the CARES Act funds were expended, 95% of CRISA, and 96% of the rescue plan. So these are all being spent. And then, right at the end of that, you have an authorization, or a new authorization. Every 5 years, Congress authorizes all surface transportation investment. And that, just from a timing standpoint, happened. The current administration, the Biden administration, is very pro-transit, and they dropped record amounts of money into what became known as the Bipartisan Infrastructure Law, or the BIL, as you see on your screen. And then they've seen fit, the Congress has, through the first couple of years of appropriating the BIL funds, to increase above those numbers capital monies dedicated to buses, purchasing buses, building facilities in which buses will be housed, these kinds of things. And I have a note here, like a Friday in January, because it really struck me. Probably the 3rd week of January 2023, FTA announced its apportionments, and this is how all of that money will be spent. And you saw an overall figure of $21 billion being spent on public transit. And contrast that with the last year of the FAST Act, which was the Bipartisan Infrastructure Law's predecessor. We went from 13 billion to 21 billion. Big growth. At the same time, the Federal Transit Administration announced a request for proposals for its competitive bus grants, which in 2014 had reduced down to about 400 million. And this January, several months ago now, it was up to 1.7 billion set aside, dedicated for transit systems around the country to buy buses largely. And those numbers, that 21 billion number, that 1.7 billion number, really represented massive growth. And the scary part is, as I say in that first bullet, I'm now starting to hear from members that it's not enough, that 20 to 25% increases in federal investment streams are not keeping pace with what a system like Herta has had to increase to keep and attract new drivers and other staff members. We're seeing 90% increases for buses over what they were pre-pandemic. Last summer, we saw massive escalations in energy costs. And so it's kind of best and worst of times, to use a really bad cliche all at once here, because these funds have kept us whole. They've kept transit operating, and they've allowed public transit to do its role of providing the essential services in communities like hers that it does. But we have members of Congress here in DC who feel like, well, we've done everything for transit. We've funded it at unprecedented, or they use the phrase generational levels, and they're not really keen on us showing up and saying we need more. And to give you a sense of like what that more looks like, I'm gonna kind of run us through here what we're seeing with the largest transit systems. Now, this is not HRDA, but this is what's happening in Chicago, in New York, in Boston, in Washington, DC. That second bullet, they lost and are continuing to lose fare revenues, fares that people pay to get on these systems. And it's largely because they're set up to provide morning and evening commutes for a workforce that is now teleworking. And that first bullet point, I give you a little context on that. 3 years ago, when you looked at through data all of the transit trips that happened in the United States, 50.4%. So just a little bit over half were provided on a bus. That other 49.6 was provided on a train. In 3 years, that bus total has grown now to 58%. And that's another way of telling you that at this point, and I am not a healthcare policy expert, I'm not a virologist. I don't know whether it's okay to say we're at the end of the pandemic or at the beginning of the end, or I don't know. And I'm not qualified to make those make those judgments. But I will tell you that wherever we are right now in the pandemic, what we are seeing is ridership is returning strongly to smaller transit systems. It's not returning nearly as strongly in big urban areas, particularly on rail systems. And what does that mean? Well, for those largest systems, they are facing budget shortfalls, the likes of which, you know, their annual budget shortfalls are more money right now than HRDA would receive in 20 years. So Chicago yesterday announced their annual budget shortfall right now is $700 million. NJ Transit today, their annual shortfall right now, $790 million. These are numbers that an operation like Julia's and HRDA these are unheard of numbers. You know, these, like I said, these are years and years and years of funding. You know, the entire rural program in the Federal Transit Administration is funded at about $980 million a year. So you can see these are shortfalls that almost match up with the entire rural program, and they can't continue. And they don't have a lot of options, because if you're running a rail system, you can't move it. You can't move it to meet new demand. You can't move it to meet new trip generating areas. And so one of the themes that I want to emphasize is flexibility right now. Flexibility is critical for public transit. The other thing to understand is, if you're saying, well, why is ridership returning strongly for HRDA and not at Chicago Transit Authority? The answer is HRDA provides essential service. I find myself telling Congress members who ask that question, you can't telework a dialysis trip. it has to happen. Most of the employment-based trips that HRDA is taking people to are the types of jobs that you got to be there. You can't telework them. And so a second key phrase to keep in mind as we're talking about like where transit is: flexible, essential. These are two things to really keep in mind. So with the big urbans facing this fiscal cliff, and with Congress here in DC saying, we don't have any money. You know, we talked the last slide about all this generational investment they made. They don't have any more. There's options that are out there, but they're not good ones because they're not increasing the overall amount of money. What they're doing is they're saying through the president's budget, we're going to offer the ability for a Chicago, and I picking on Chicago, they're not the only ones in this position. We're going to offer them the ability to use funds that traditionally have been set aside only for capital and slide those over into operating to offset what they're losing at the fare box. But any transit manager, when they hear that, understands what that means, which is, okay, I'm going to be able to maybe keep operating, but my equipment's all going to get older. My technology is not going to be maintained properly, and all of my capital. And it's a very difficult trade-off. The other interesting thing, just to mention while we're talking about this, was for HRDA, the president's budget, which will not be adopted. It will not. But when the president's budget came out, it included all 5311 and 5310 funds in the next fiscal year, arriving at 100% federal. Now, that was a lot of technical stuff there. But what I'm trying to, the way federal transit investment works is for every bus that HRDA buys, 80% of that bus is bought by the federal government and 20% is bought by local and state funds that are necessary to quote unquote match the federal funds. It's how HRDA and any other rural system, frankly, any other transit system in the great state of Iowa, that's how they capitalize their agencies, is with 80% federal, 20% local. HRDA, as a rural, is allowed to use its funds to operate, but that's a 50-50 match. So now for every dollar that HRDA uses of its federal funds to buy fuel, it's got to match that locally with $1. So when the president's budget says, hey, no need for local share, it's a good thing. And it helps. But it also raises the concern about, and it's, I think these kinds of sessions that HRDA's always been good about doing and talking with locals is that the most effective transit systems are supported locally. And the more they are dependent only on federal dollars, I always start to worry about those agencies. And I used to ask this question when I would work with transit systems, and I would say, if all of your federal funds went away tomorrow, what would happen? And I would worry about the systems that would say, like, immediately, well, we'd be done. Now, we all know that the trips that are being provided in your part of Iowa are essential. So they can't just go away. We couldn't allow that to happen. So this match of the local investment to the federal investment is critical. Last thing about federal investment is also important to keep in mind. These aren't funds that were printed up a couple blocks from where I'm sitting right now, and out of the goodness of Washington, D.C.'s heart, they're providing back to your counties in Iowa. These are funds that were collected every time residents of your community put fuel in their vehicles. There's a federal gas tax of 18.6 cents per gallon. and 20% of that 18.6 cents goes to transit. So that's the other thing I try to remind people of when they're saying, oh, you know, that local money is used to leverage and make sure that HRDA gets back its maximum share of what it already put into the quote unquote highway trust fund and the surface transportation trust fund. I'm open to any questions because, you know, I never want to get this to be too in the weeds, but it's hard not to in our business. The bus capital struggle. Systems HRDA size are finding it increasingly difficult to find vehicles. The combination of the supply chain crisis, a Buy America set of policies that restrict what Julia and HRDA and what Brooke can buy, and then the lack and the procurement process, you won't be surprised since these are federal funds involved, is to say the very least vexing and not an easy process. Julie, I see you have your hand up.
I do. So you talked about the gas tax, which, you know, that's what we've relied on for years. But what, if anything, is being done proactively where more people are looking at going, you know, lower, like electric vehicles or alternative fuels? What's going to happen then for funding with the gas tax?
Yeah, there's got to be a tipping point where we move towards that same kind of tax being levied on the amount of miles one travels on the highway system. Because you're right, the more electric vehicles, just for those of you listening in, anybody driving an electric vehicle right now is not paying into the maintenance of the highway, is not paying into bridge maintenance and new bridge construction, is not paying into public transit investment. They are outside of that because the entire system is built around gas stations and pumping gasoline into vehicles, not just gasoline, diesel as well. So there's a lot of thought in DC about moving away from it. It used to be a lot of discussion about raising the gas tax, which neither party has wanted to touch. I think the end game is a vehicle miles traveled, which would incentivize people to travel less. The less you travel, the less you pay in taxes, and that would capture all the vehicles, because a electric vehicle degrades the roads and bridges just the same as a gas-powered one, but one of them's investing in the system and one isn't. This is a place where technology has kind of moved ahead of a funding mechanism. And there's been some tests done on vehicle miles traveled. You won't be surprised to hear that Congress fights about it a lot and doesn't do anything. Big shock. And you won't be surprised to know that the issues that come up are things like, I don't want the government knowing where I am. And you have to explain to people that a vehicle miles traveled will be like an odometer. It's going to tell you how far you've gone, not where. But in an age of disinformation, that sometimes that gets mixed. So does that help, Julia?
Yeah, that helps. I get concerned when they talk about miles traveled, that's going to once again look at people in the rural areas and put that burden most on them. And we've talked for years about people being able to age where they're comfortable. And a lot of times that is in the more rural areas, but if they're going to start taxing them, I mean, maybe it would be good for public transportation. Maybe there would be more money in it for public transportation. So transportation could get better so that there's not all of these gaps that we have now because we don't have enough funding, but that's a big concern of mine. And living in a rural area myself, that would be concerning.
and with rural regions kind of becoming more regional. When I started at CTAA, it was not that way, but now systems, and HERD is a really good example. You're covering more territory, and we've argued to some success that there would have to be some sort of rural equivalency because of the miles traveled to do the same things brought into a VMT funding mechanism for that exact reason. I agree with you 100%.
Okay, thank you very much.
Sure. So now we're in this weird position. Again, it's not one I've ever been in before, where we have money to buy buses and nothing to buy. Or when you can find vehicles, they're in some cases twice as much as they were. And we're starting to see the same thing with larger buses, the 35 and 40-foot buses you see in Des Moines, as an example. And then last on the bus capital struggle is, of course, there's an emphasis by this administration on zero emission buses, which largely has meant battery electric buses. The batteries have range, usually 80 to 90 miles, and they need to be recharged. That's a tough one for rural transit. It makes great sense if you're in Ames and you're running a 40-foot bus or a 35-foot bus around campus, and your total of your route might be 5 miles, and then you're coming back for a quick recharge and then running your route again. It makes a lot less sense when HERD is going 50 miles one way with a medical patient and not knowing where we could recharge. So there's some challenges in the entire emphasis on the zero emission bus, particularly in rural America. That's not to say that we don't see them having a role. We do, absolutely. And we're seeing some technologies that are increasing the range. All of them come with major sticker price increases on the cost of vehicles. So again, and what you really end up with here is a challenge to the leadership at HERDA, a challenge to the leadership at the Iowa DOT. What we're asking, HERDA, Iowa DOT, we're asking you to make capital decisions that tend to be, you're thinking in 10 and 15-year increments. If HERDA was to say, we're going to go all in on battery electric, then that means there's a lot of infrastructure that needs going to be funded. And that's not something that they would take in lightly. And they would do that with a longer term. But then we've got a political reality that's changing every 2 years. And I had someone call me recently, a member, and they said, well, okay, Scott, it's 2023 right now. All this emphasis, all this money is being put in battery electric buses. And let's just say that in 2024, a Republican is elected the president of the United States. Will all this emphasis on ZEBs go away? And I said, I don't know. Like, I would bet that it would change. And that's the reality that a lot of the decision making for public transit is in the middle of. The political process changes so quickly, and what we need is emphasis and commitment areas when it comes to something like public transit that can span Republican or Democratic leadership, that there's agreement overall across party lines that this is the way to go. Now, I'm going to be honest and tell you, I don't always see that level of thoughtfulness on the part of Congress and in the political process anymore. So this is part of it. And I end with a little bullet point there on human capital, because to make all these kinds of changes, all what we see on this slide, it requires more specialized and expert employees to be able to do these things, and it requires whole different types of maintenance expertise that is a challenge as well. So it's the challenge of making these transitions is not just finding the vehicles, buying the vehicles, finding the charging infrastructure, buying the charging infrastructure, managing the political realities of all these things. And then on top of that, finding staff and employees who have the expertise to arrange this. We are seeing labor market challenges in transit that we've never seen before. Severe competition for drivers and other staff all across the gamut. With the pandemic, a lot of our economy went towards delivery based. And what do those delivery based economies need? They need drivers and they need vehicles. And they are a competition directly with HRDA. So I'm talking about small, little, not very well funded organizations like Amazon and UPS and FedEx that are now in direct competition with HRDA and every other transit system. And how are they marketing themselves in that challenge? They're telling a driver, you come here and guess what? Packages don't complain. You can set your own schedule. HRDA needs to operate in certain schedules. They need a certain amount of drivers to be able to hit all the targets they've got for their ridership every day. If Julia just said to all her drivers, you make your own schedules, that wouldn't work. And so it's a challenge. We've seen major changes in the commercial driver's license. You see CDL there, big issue as well. We have many smaller agencies. The federal law says a vehicle that has 16 or more passengers, not on board, but that can carry 16 or more passengers, that driver has to have a commercial driver's license. Well, the competition for CDL drivers is even more keen than regular drivers. And so you're seeing a lot of systems move towards smaller vehicles so they can get away from having to have that. But in the transit business, we sometimes need those bigger vehicles because there are times when you may have that kind of passenger load. And from an efficiency standpoint, if you're a rural operator, the more people you have on the bus, the more efficient you're being. If all the system is ever doing is taking one person and one person and one person, we're a taxi cab operation. Transit, public transit is most efficient when we have groups of people going to different places or maybe going all the same place. One of the big things too about drivers has been safety. And we are finding that that is a major challenge right now. I can't put my finger on it. I've asked a lot of experts, but we are just seeing negative passenger driver interactions at levels we've never seen before. And they often involve violence. And it's not just in big cities. We are starting to see this in smaller cities and in rural communities as well. It's been just this change. And these are people that in varying ways, and some of HRDA's passengers, I would imagine, fit this notion that they're having kind of mental health crises and they happen to play out in our space, on our vehicle. And we're not the only ones. A lot of industries are dealing with this right now. If you talk to anybody in retail or education or healthcare, they're seeing the same thing. But it impacts finding drivers for sure. The ridership reality, we talked about safety, we talked about smaller operators experiencing stronger return. The other thing, when I mentioned flexible and essential earlier, that third bullet point here is the critical one. The best transit systems are those that are led by people who can provide flexible service that can change to meet new travel patterns, new trip generators, new demand for trips, and whose systems are not set in concrete, but rather are constantly evolving and changing. to meet where ridership is growing. Overall, and again, since we're doing a kind of state of the union of public transit, in this country, for 60 years, public transit investment was largely dedicated to the morning and afternoon commute. And it was only in areas like rural Iowa where this notion of community-wide mobility was the reason or the rationale for providing public transit. I believe we are entering into an era, and the pandemic has ushered this in, where even the biggest cities' emphasis is going to change from the morning and afternoon commutes to community-wide mobility. And if you're going to provide community-wide mobility, you've got to be flexible. You've got to have flexible vehicle fleets. You've got to be able to also, and it's an important piece that you're going to hopefully discuss later today, and as you all who are advocates for transit in your communities, outcome-based values versus volume-based values. And what I mean by that is HRDA is never going to be able to provide trips as efficient as Julia and Brooke and all the other employees are there at the same numbers as they do in the urban areas in Iowa, to say nothing of Los Angeles or Seattle. But the value of the trips that HRDA provides, Julia just mentioned, all the older adults that can continue to live independently in the way they want to live because HRDA is there. The positive healthcare outcomes that HRDA is giving and providing in the community every day by doing simple things like dialysis and chemotherapy, by making sure someone can get to a doctor's appointment and keeping them out of the emergency room, by making sure and reducing no-shows in the healthcare space, by providing access to healthier foods, by helping hospitals with discharge. All of those things that a lot of systems like HRDA are doing have real value. And transit, Julie has heard me say this a gazillion times, has always just kind of evaluated itself on just volume. How many riders today, this week, this month, this year? Now, in an era of community mobility, we're going to need to be able to articulate what happened because we're here. What value is the community getting beyond just numbers of butts in seats? What value is the community getting? And the systems that do that well are the ones that are going to thrive, because they're not going to have to struggle with a local elected official when they need to come up with that local share. That local elected official is going to understand what the system is bringing and all that it's doing to make that happen. So this is this new era, and sometimes it makes me really angry. I'll have to go into a meeting with an Uber or a Lyft or some other technology company, and they will absolutely act like they invented on-demand mobility. And I kind of sometimes have to remind them that when all of those software engineers weren't born yet, systems like HRDA were providing on-demand mobility as far back as 1981, as Danny mentioned at the beginning of this. That's always been what systems like HRDA have been doing. So, you know, we don't get credit for all that time. And these technology companies and others like to think like, look what we invented. And it's like, yeah, we were already there 20 years previous. What the technologists can do is make us more efficient, give us better tools so we can get more people on the vehicles. And that's an important contribution. But, you know, the whole idea of how we look at on demand has changed. When I started, The ADA passed in the early 90s, and we thought a 48-hour advance notice window for anybody to book a trip was life-changing. And the bottom line is, any of us, if we were asked to live our lives 48 hours in advance, would find a diminished life. And as we move into one of the things these technologies do, they allow us to do more things directly and immediately on demand. Does HRDA have the vehicles and the staff to just be able to provide immediate, within 5 minutes, on demand? No, not yet. But the movement in that direction, I think, makes a lot of sense. And so that's kind of the new era that we're in. And let's see. I think that might be the end of my deck. CTAA, we're here to help. This audience is well aware. You're going to hear from Taylor that's going to talk about advocacy. These are the things we're working on. And, we want to continue to partner with all of our members to help them. So I saw there was a question, and I'm going to stop my share screen now, Danny, and move into those because I think it's important and we got a little bit of time.
Yeah, so we can question here in the chat. How can HRDA funders capture that value? What common metrics can you recommend for best capturing that?
It's a really good question, Sandra, and every kind of community jumps at that differently. But sometimes it's being able to measure the difference between outcomes where people have a trip and they don't. And we see that in a lot of social service pieces and others, when we can offer and connect people more effectively with those services, the outcomes improve. Healthcare is great because they measure everything. And, if you go to some regional hospital centers within HRDA's service area and you say, okay, what does a 5% improvement in no-shows create financially for the hospital? You'll be astounded at how much money they lose on a daily basis because people don't show up for an appointment, or perhaps a scheduled procedure where they have all the experts have been brought in, the equipment's been brought in, and you can just, like I said, a 5%, 10% reduction in that is going to have major financial impact on a healthcare institution. Obviously, there's the work piece, measurements. I once worked with a system in Missouri that did it so simply and effectively. And, we sometimes forget these common, easy pieces in the new world of social media and, smartphones and all the other things. They gave all their passengers a business card. And the business card said, hello, my name is blank. And the person could write their name in there. And I came to your store today on a HRDA bus, and I spent, and there's a blank line, $14. And they gave them to all their passengers. And whenever they went to a retail, they said, drop these off with the cashier. And then some of the staff for that system came back around a month later, and the manager of these different retail establishments was like, this really adds up. There's a lot of people here coming in, spending X amount of money at my facility, at my store, and they're getting here on transit. That was, again, a very low tech, but effective way of making the point that there are really important economics that transit can bring to it. Oftentimes, too, in terms of those values, HRDA employs a lot of people. And that's a lot of income coming into the community, a lot of tax paying residents in the community. HRDA also partners with all sorts of community-based organizations that are benefiting. That's another place we look at. What does it cost the state of Iowa when a senior has to be prematurely institutionalized? Or what does it cost that family when a senior has to be prematurely institutionalized? What does it cost a family who can't have somebody work anymore because they've got to take an adult parent who has to go to dialysis 3 times a week and they can't hold down a job? Well, transit allows them to hold down that job. So you got to look at it kind of through those lenses, and that's what I try to ask systems to do, Sandra. And the every local community has their own very unique threads to pull on to find the value and kind of common metrics, and tell that story in a little bit different way. But it also has to come from the leadership of the system that says, I know Julia and her team have, I want to look at the value of what we're doing beyond just the number of trips we provide, because that's not the most effective way to value what we're doing. Any other questions?
Scott, is the federal government going to start looking at funding us in different ways besides just miles and rides?
You know, they are collecting boatloads of data, as you and your staff know, with the NTD and stuff. I have not heard that yet. For small cities, which are population 50 to 200,000, so we're talking Iowa City and Ames, I think, are both in that category. There are some funding streams that are performance based. The STIC program, which I know you're aware of.
Yeah, we don't
I'd
get any
like to
funding
see-
from it,
But I'd like to see some of those kind of metrics brought into rural, where systems that are providing more trips, that are covering, more miles, and also maybe some of these other outcomes that we're talking about could attract more funding. The challenge, of course, is our membership as a national organization would tell us, well, I'm okay with that as long as I don't lose anything. So it would have to be like an incentive tier on top of a current funding, as opposed to in exchange for your normal funding. Now it's going to be, I have enough members that wouldn't go for that. It
Yeah.
would be a hard sell. Yeah.
okay, thank you. Back to you, Danny.
All right, we do have about 10 minutes, so if anybody else has any questions or anything, I see Brooke made a comment here in the chat. STIC funding is funds provided to systems with very short routes and high ridership. You tend to see this applicable in college towns like Ames, Cyride, and Iowa City's campus.
Brooke knows her stuff, and that's exactly it. It was really, the STIC program was created by a group of college towns who were providing lots and lots of service and couldn't get the funding levels they needed to keep those systems operating effectively. And they created the STIC program about 20 years ago to help fund that.
Any other questions for Scott?
Well, I'll put my email in the chat, and if anybody has a question that they just don't feel comfortable sharing aloud, or you can email me directly, and I'm happy to answer any questions. And as always, it's an honor to come and speak with you about these issues today. And I hope I didn't get too in the weeds, but it's hard not to. I try to end a lot of these kinds of discussions with the reminder of two things. Public transportation is a people business. Okay. HERDA's job isn't running buses, it's moving people. And the essential element in public transit is the trip. It's not the bureaucratic hoops that HERDA has to jump through in order to get its federal funds. And a lot of the stuff I was talking about today, the essential element is a safe and efficient trip.
Yep.
And when leadership at a system never loses sight of that fact, those are always the healthiest and best run organizations because they're not forgetting what they're there to do.
Very well said, Scott. I appreciate that. And not to go off topic but just for a real quick, could you just explain to the audience, we do a lot of dialysis trips and they're expensive trips. And dialysis does not pay for those trips. They don't even help in the majority of it, even if they could. But what is that barrier that dialysis, because they keep telling us it's, when we contact them, that it's a higher level rule and regulation that their corporation has said they cannot help fund, but we know at the federal level they can if they wanted to. So that's a huge barrier.
I don't want to disparage anybody, Julia, but I'll say that they are hiding behind a federal rule, and the federal rule in the healthcare space makes sense. If you're a doctor and you're taking in Medicaid and Medicare patients, okay, you're getting a lot of federal funding to provide those healthcare services, there's a disallowance that a doctor can then set up his or her own MRI for-profit facility and can kind of double deal all of its patients into a profit-making other piece. So there's rules that say you can't do that. The dialysis companies are misapplying that rule to say, and by the way, we're talking highly profitable for-profit dialysis centers. Okay, we're not talking about mom and pop scraping by organizations. We're talking about organizations with revenues well into the billions. They hide behind that to say, if we transport, then we are violating this healthcare rule. That's what's happening there.
Okay.
We're trying to work with the federal government to make clear that that is not accurately being applied. And my cynical belief is that if we were able to get that, they would hide behind something else. And it's frustrating because HRDA's providing a client base for them for free. And oftentimes CTAA members will tell me we're providing, a good portion of their customers, and still people who need public transit to get to the dialysis clinic, they'll put them on a Tuesday, Thursday, Saturday a schedule, and the transit system isn't open on Saturday. And things like that will happen all the time. And I think a lot of our members, if the dialysis clinic would just work with them a little bit, it would be progress.
Yeah, and we've had pretty good luck with them working on us on what days we go. It's just that funding part. There was a situation where they closed one of their clinics because it was no longer profitable. But that now makes us have to take people 30 miles outside of where we were taking them 2 miles. And we're the bad people because we're like, I don't know that we can do that. And dialysis is really important in our world of transit, especially to HRDA, that we want to be able to help these people, but we're expected to fund it all. And that's just it. There's just something that doesn't sit right with me. And I don't know how to get around that or how to get people to understand that we need help with that particular aspect, because it's not just one trip here and there. It's 3 times a week.
Right.
It could be years.
You're 100% right.
So
Hopefully years. Yeah.
Okay. All right. Well, thank you for that.
Thank you, guys. Good luck with the rest of the meeting.
All right. Thanks so much, Scott.
Thanks, Scott.